Tomorrow, we will remember the 9/11 terror attack 17 years after that awful day. And we are still getting terrible news about 9/11 even all these years later. The Journal News has found that by the end of this year, more people could have died from toxic exposure to ground zero than were actually killed on that day itself. Now, the paper has also put together this video that explains it.
It's been 17 years since 9/11, but the death toll continues. Soon, more people will have died from the diseases caused by the toxic exposure at ground zero than were killed on that terrible Tuesday in September. We're nervous, said Dr. Michael Crane. He is medical director of the World Trade Center Health Program's Clinical Center of Excellence at Mount Sinai. The site posed myriad dangers for months. The dusty air was permeated with burning jet fuel, melting steel, asbestos, burned electronics, concrete dust, who knows what else. It was like gray moon dust, said Dr. Ray Basri of Goshen. He was at the World Trade Center as a volunteer physician that day, within an hour after the South Tower fell. Basri, a professor of medicine at New York Medical College in Valhalla, does medical screenings for firefighters throughout the Hudson Valley. I really do think we're in the early stages of seeing this, Dr. Basri said. Sadly, in our communities, we will see more funerals for those who rushed toward danger and stayed to help any way they could.
And joining us now from the Journal News is Nancy Cutler, whose voice you just heard. She is a member of the editorial board and also the engagement editor. And Nancy, you've spent years following up with this population. Obviously, not just the people who lost loved ones that day, but people that have been afflicted with a host of illnesses. I want to get a couple numbers from your reporting that surprised me, and I thought I'd follow this. Last year alone, 23 members of the New York City Police Department, current or former, died because of 9/11 related illnesses. That's the same number that died on 9/11. And for the FDNY, as people know, 343 members died on September 11, 2001. And in the past year, we're approaching 180, well more than half that were lost that day. And these numbers aren't with finality. They keep growing here. I think that there was a sense, my God, the open wound that was 9/11, well, that was the end of it. Far, far from it.
Right. And, you know, one of the things I looked back at some of the numbers that we had of people dying, and in July 2016, people were shocked that we had reached the 1,000 threshold for numbers of people who had died of 9/11 illnesses, and now we're at 2,000. So this idea that soon we're going, the number of people who have died of illnesses after would eclipse the number that died that day is, you know, it's simple math. It's going to happen sooner than probably most people expect, and especially the growing number of cancers, because now we have 17 years out. And as you know,
they believe we found a link, right? That there's a direct connection to it.
They have shown, and I talked with Dr. Michael Crane, gave me, you know, the idea that here we have cancer in a relatively young population. You know, the average age of a 9/11 responder today is about 55, and the cancer rates for some of these very distinct cancers about 30% higher in this population. And you know, the New York Post just had a story about men with breast cancer, a large number of men with breast cancer who were among those who were working in rescue and recovery. And we have young students who are now in their 20s who are developing cancers who were students down in that area that day. So, you know, Dr. Basri, who is a volunteer firefighter himself from Middletown, he said he thought the numbers we're only at about 15% of the bell curve. Jeez. You know, that it's going to get worse, it's going to grow.
I want to remind people, when the attacks happened, there was not the luxury of time, but there was the messaging from the federal government that it was safe at ground zero. Chrissy Todd Whitman, formerly the governor of New Jersey, then the EPA head, she said this on September 16th, 2001.
You know asbestos was in there, is in those buildings, lead is in those buildings. There are the VOCs. However, the concentrations are such that they don't pose a health hazard. We're going to make sure everybody's safe.
Okay, now I've spoken to Ms. Whitman after that, and she said I was going with the information I had. That said, is there resentment and even anger from a lot of the folks that they said, hey, your government said it was safe, go on in, and no surgical mask was ever going to protect them, and they went in anyway?
Well, you know, there's so many years past, and you do hear frustration about that, and especially when people were advocating to get the Zadroga bill, which passed,
Sure.
which established the health programs,
And that took
also
well
the
over
victims.
a decade to get
Right.
that passed, which was, I'll editorialize myself here, a national shame. But anyway,
Right.
I'm sorry to interrupt.
You know, but a lot of the first responders especially said, you know, we would have gone in anyway. That's what we do. They run toward danger. And we forget that, you know, if you remember those days after, they were searching and searching for survivors. I mean, it was still a rescue effort before it became recovery.
But people were on that pile for months.
Yes.
And they were still under the impression that everything was safe. Maybe they wouldn't have changed, but
Right.
to me, what was frustrating, you mentioned the Zadroga bill. The other part is the funding for these folks here, which is really what the Zadroga bill, it gave health care to treat people who ran into the danger and stayed at that site years after. Talk about that, because we have a population, as you said, the numbers are the numbers. More people will have died after the attacks, from the attacks, than died on that day. The funding isn't matching the need.
Right, and I'm actually working on a story now about that. The Zadroga bill in 2015, because of the efforts of the first responders themselves who walked the halls of Congress practically constantly, is set up through 2090 for the World Trade Center Health Program, which provides screenings and health care, and also does, you know, helps with a lot of research. So there's been some interesting developments for care out of that. But there's another part of it, and these are two separate things, and people don't always get that, is there's the Victims' Compensation Fund, and that's the money you get for being compensated for being a victim of a terrorist attack, money to help with your family, to help, you know, if you're ill, or for your family if you die. That was only extended in 2015 for 5 years. So on December 18th, 2020, that
Yep.
closes, and that has been extended a few times, but there's no bill right now to extend it. It needs to happen now. And also because as we go further out, there are more deaths. The number of deaths grow because of the latency period of these diseases. That fund may not make it till that day, 2020. It could run out of money, and that's a real concern. And people like John Feel of the Feel Good Foundation and John Stewart, who have been amazing advocates, have been all over in the last few weeks reminding people of that message, and I think it's a really important thing for people to remember. This is going to come up in